All right. Well, it is 3 o'clock, so we'll go ahead and get started. I know people are coming in. Just wanted to remind everyone that we are recording this and we'll send it out to everyone afterwards. We're also going to send out the slides in a follow-up email. And we've muted everyone's microphone, but you can use chat or unmute to ask questions, which we hope we'll have plenty of time for. So I want to introduce today's speaker. Daniel Creitz has served as the Senior Vice President and Chief Compliance Officer at Community Health Center of Southeast Kansas for the past 8 years. He's responsible for all legal, regulatory, and compliance matter. And prior to joining CHCSEK, he practiced business and tax law in Pittsburgh and holds his JD from Washburn University School of Law. And we were just talking about what a big booster of Topeka and Washburn he is. He is licensed, a member of the Kansas Bar Association, the Oklahoma Bar Association, and the Bar of the Supreme Court of the U.S. So we're so happy to have Daniel with us today. And Daniel, please get us going.
Yeah. Okay. Hello, all. We're going to talk about grant conditions and applicable legal requirements today that relate to those grant conditions. There are a number of topics we could go over, and this likely will involve a part two discussion down the road. But we're going to kind of do some foundational work today, and then in addition to the slides, you should either have or be getting kind of a checklist slash index of that you could reference in addition to the slides. So here we go. I'm going to go through, this is kind of the three basic topics. There'll be a couple things near the end, but we're going to go through kind of a common overarching theme and actually the technical definition for what is considered a federal grant award. And then we're going to go through some grant conditions, and then I'm going to walk through some suggestions that really tie back to the checklist and index that I was just mentioning. So as it relates to federal and state grants, they all have some very generic statements and some common themes. So if you were to read, state grants or federal grants, they're going to say pretty similar things. This is kind of paring down an applicable grant that I was working with here recently. And it acknowledges that this grant, and then you insert, grant condition, grant award, grant contract utilizes federal assistance. Utilizes is defined in different ways in federal law, but usually that means you are either the recipient or subrecipient. When procuring property or services using the federal financial assistance, the entity must follow the same policies the entity uses for non-federal funds, along with other requirements, namely underneath Title II, which is your uniform guidance on cost principles and audit requirements. As it relates to health centers, everybody knows that you're basically audited 12 months a year and have an audit firm that helps assist in that and then publish your audit. And so this was where this particular statement was leading to, but I thought it was a good precursor as it relates to how these things are discussed frequently on paper, and is a good thematic for these slides. Federal award, I'm gonna talk about here briefly, but federal award is defined several different ways in federal law, and this is the best definition that I've can come up with. But federal financial assistance that is a recipient receives directly from a federal awarding agency or indirectly from a pass-through agency. So federal financial assistance that can be both for services or programs that a recipient, that can be you as a health center, an H-80 grantee receives directly from a federal awarding agency, HHS or HRSA, or indirectly through a pass-through entity. Indirectly would often be state grants that are in part supported by federal awards. Knowing that baseline and knowing that overview, this is what we're going to talk about next. when we go through each one of these provisions, you're going to notice, well, I don't cite um, a specific federal law on these, mainly because these are basically common provisions now that are embedded in different federal laws in case law predominantly. But not all of these do I tie back to a federal statute, but we're going to talk about a lot of these. Um, and then the reference guide will help on good chunks of these. Then after that, we're going to talk about again discriminatory provisions. I try to go through a lot of the big discriminatory provisions in these slides, um, and so we're gonna hit on these. And again, the checklist also includes these. Then last thing we're going to touch is really procurement, and how this affects us in several different ways, particularly as it relates to capital awards. If you've ever received a federal capital award or state award of similar nature, to build infrastructure and build up clinical presences. So we'll talk about these. Okay, I'm going to start with the general grant conditions. Um, and this is this is going to be kind of the bread and butter, things that have existed for years, that are largely non-controversial. And so here we go. Confidentiality. Um, Confidentiality outside of HIPAA and high tech and FERPA. This is really what it means as it relates to a grant. So, except for information, so like PHI, deemed confidential by a federal authority or applicable law, uh, that information is actually not deemed confidential and are disclosable by a federal authority without further approval or notice. So that what that means is that if a federal law doesn't specifically say that it's confidential, it is not confidential and it is discoverable, meaning the federal authority can disclose that without further notice. So that would come into play with like a federal grant. So if you apply for a competitive federal grant, a large chunk of that can be disclosed by the federal government. That's the reason for things like abstracts and narrative statements as it relates to those grants. There's really only a couple specific exceptions to that rule, meaning where everything is confidential. And there's nine specific exceptions and three specific exclusions. Um, uh, they're very narrowly tailored. So, national security, trade secrets, and law enforcement, and then really some more counterintelligence and international terrorism based exclusions there. So, uh, as it relates to this information, that what's commonly not you cannot sell it. So, if you're an entity that receives um, a grant award, you cannot sell that information. And really, grantors, I haven't seen where this has become a problem, but I think this is more of an issue between federal and state grantors and private philanthropy, where you might be copying ideas off each other. So, not seeing this so much from a grantee perspective. Um, After you deal with confidentiality, conflicts is a big thing. When there's a conflict between a grant award, including attachments and hyperlinks and uniform guidance and an applicable federal law, the term or condition is void and unenforceable. So, what a lot of people, common misconception is that a grant award or document is controlling. That is not accurate. A federal statute or federal reg is the primary source of the law, and the secondary source is the condition. So, and then the primary source always beats out the secondary source. And so, additionally, there's no waiver. Some unique laws allow for waivers, but there's no waiver in this particular scenario, meaning at all times, the federal law or the federal reg beats the grant award document. So, um, again, something that's not commonly known, but there is times where um, grants and what is being solicited in a grant can contradict federal rules. That's not so much up to the grantee to narrowly tailor that to figure that out, but they do need to know that if it does come up and there is a conflict, that the law will win, and the statute will win in the end. Um, this really, as it relates to the second bullet on this slide, uh, at all times, regardless of the particular federal administration, you want to keep grant awards in existence, and so they're going to narrowly tailor any conflicts that they can. And so, just because that, in particular in healthcare, that continues to promote better healthcare and better outcomes. So they're always going to narrowly tailor it. There's been a couple federal courts that have advocated for narrowly tailoring of these issues, and those courts are across the country. So, but the something to keep in mind is they really don't. They want to narrowly tailor the conflict and limit severability as much as possible, and then keep the award in place at all times. Debarment, we all know what debarment is, but a lot of people don't know that debarment is listed in just about every grant. There's some baseline that says that you are going to understand the debarment rules and that you're not going to engage with entities that are debarred and that you are going to document that. And so that is no different for the world we live in. Largely, those statutes say that you are not gonna participate or engage in a federal award or a program, federally supported program, with excluded or disqualified entities or individuals. Um, Most of the time, there's a certification. I've seen that more on Department of Justice grants than I have necessarily on HHS grants, that says that this is a material representation of fact that you are not engaging with those folks, and that if you don't comply, meaning that you do engage with them but said you didn't, that's a later reason to debar your agency. And so the feds are getting a little bit more specific on debarment, which is okay, and that was to be expected over time. Similar to background to debarment is the necessity to do background checks and criminal history. These rules, as it relates to grants, really fall pretty much in line with health center rules. So are you doing your criminal history checks as it relates to employees or contractors? Um, uh, and if necessary, you might be asked to produce how you vet that. And so just something to keep in mind as you grow your program. Insurance, um, uh, insurance is getting a little bit more strict. As you all know, the FTCA rules continue to kind of evolve and get a little more stringent, and I believe that'll be the case with insurance as it relates to underlying grant responsibilities. So most grants I'm seeing are, you're going to maintain that $2 million occurrence limit. Some have aggregate limits of close to 5 million, but you're at all times going to procure your own insurance to ensure you have coverage for what you have said you're going to do as a condition of that grant in getting that award. Invoicing and payment. This again, similar statement in a grant. You certify to the best of your knowledge and belief that the report is true. I think you all know that when you submit an invoice and seek payment, you're stating that it's factually accurate and not fictitious. So most of these have a statement that says, subject to criminal penalty or administrative penalty, and we'll talk through those penalties later on. But it's you do certify that your payments are accurate. Um, any request for reimbursement uh, uh, that is you not allowed. You must have special conditional approval and supported by line items. That comes in a lot with rebudgeting. Are you doing timely rebudgeting? Are you drawing out your, if you're needing to realign costs between personnel and contracts, are you aligning that out in your grant? How are you documenting that from a support perspective, and then submitting the invoices timely? And so that's really what this subpart of the federal law states. Something that is hitting a little bit more close to home recently is travel. I've noticed on several grants that travel, as it relates to being an expectation of the grant, usually has two or three different categorizations. One categorization would be mandatory travel related to grant-specific training and education. So are you documenting that well? Do you have the amount that the grant is supposed to that you're supposed to allocate per the notice of award guidance? I think two grants I've seen recently was between $5,000 and $10,000 allotments. Did you have that addressed? Is it there? Did you put it out? So that line item is important. The other two categories after you get past that is more travel relate specific to the grant, meaning are you delivering patient-facing travel? Are you billing for mileage or cost reimbursements? And then the last thing is the reasonableness of that travel. And are you comparing it against published rates, per diem rates? And so those are really a lot of I'm seeing a lot more specific travel stuff. It's probably, from a policy and procedure perspective, um, a more all encapsulating thing, saying that you have travel policies, you have and those policies address per diem rates or mileage rates, and how those things are allocated. But I think, um, particularly, being health entities in Kansas, as it relates to getting grants, we're only going to deal with travel allotment more. You're not going to see it less. And so I think this is going to be a common concept as we move forward, and likely will be, as it relates to a second um, webinar. This will be a more pressing topic we'll talk about in a second webinar. I'm going to move from invoicing into competitive bidding, and we're going to talk about procurement here in a minute. But the federal government, really for the last several years, uh, probably back to mid-COVID, has been pretty specific in the fact that you need to maintain competitive bidding processes. Um, and are you doing that to the best of your knowledge as it relates to just about everything that you can do competitive bidding on, except for if there's a sole source exception? One thing that I've noticed a little bit more is really the Buy American preference. This has been around for a number of years, but really going back to probably President Trump's first administration when he started really hinting at this, and then it maintained during President Biden's administration and still exists today, is the Buy America preference as it relates to competitive bidding. So this specific statute says, or regulation says, that federal awards where funds are appropriated and made available for infrastructure projects, should use really the Buy American preference for that federal award and for the scope of that award. So, what does it mean when it says infrastructure projects? And so, most people, when they think infrastructure projects, think roads, highways, bridges, public transportation. But buried within that regulation is broadband infrastructure and buildings and real property. And so, while most of this might not technically apply to healthcare, two big things is most of us do get affordable broadband um, uh, through a federally supported program, and if you are engaged in federal capital projects, there is a Buy American preference buried in it. As that relates to your particular health center and your entity, it might be making sure that your contractors are aware that if they're getting structural steel, that this preference exists. And so, um, but this is again, talking a little bit about travel, this is going to be a bigger point of what we would do a second webinar on, really hammering out the Buy American preference and then what this means for capital projects, primarily related to those 2 points I have in bold. Audits, again, gonna not spend a ton of time on this. We all know that we engage in audits and have to maintain accurate records. And so, the applicable federal agency can audit those records basically on command. Um, uh, One big thing is that the federal law does say pertinent record, but they can also define what is pertinent for that award. And so the federally, HHS really delegates a chunk of that authority to the Treasury. But those three entities I have up there, the state of Kansas, U.S. Treasury, and the Comptroller General are really the three that would come into play most often. Um, uh, but and then specifically, there's been cases where the Treasury Department, I've seen this in some cases, specific case law, where they've come on site to verify that things have been performed and work has been completed, primarily when it relates to large overtures in capital construction projects. Audits and records, something I would like to point out here as it relates to record retention. You do have to be careful if you do get an audit or an investigation into a specific grant, mainly a capital related grant. There is an additional basically 2 year waiting time. And so I always basically say take the 2 plus the 7, you got 9. That's probably your safe bet as it relates to maintaining of records after an audit period like that. If you wanted to be overly careful, you'd keep these records for a minimum of 10 years. But that's kind of a little bit of a hidden gem in that particular regulation as it relates to, well, your 7 year period may be stalled, just depending on how long that audit takes. Termination. This has been a little bit more prevalent in the last couple of years, but grants can be terminated for insufficient funds. What defines insufficient funds? It would be reappropriation of money, which happened last year which resulted to some cancellation of grants. Most reappropriations go through Congress, and so something to just keep in mind. Usually, the customary thing is that you're given 15 days notice. I feel like that might not be enough, but that's usually what's written. And again, kind of back to narrowly tailoring. If there's a termination of a grant for insufficient funds, they really want to keep the grant in place as much as they can. So if there's a portion of a grant that goes away, they don't want the whole thing to go away if they can avoid it. So I can give an example there as it relates to a grant award that included both services and capital. So if a grant related to capital went away, they would try to keep the services in place. And again, you're supposed to minimize your costs if there's a termination. Force majeure, you can temporary exclude and stop performance if there's a unforeseen circumstance beyond your control. This can differentiate a lot. There's been some, with the existing activities in the Middle East as it relates to the Strait. There's been some grants that have actually said, you know, that is a war, but you know, Congress didn't declare it a war. And so there's been a little bit of confrontation as it relates to that because that, you know, that has caused supply chain issues on some sole source stuff, and which has caused some delays in grants. And so they've tried to say that's a force majeure, but then the feds have said, well, you're not in a war, but it's kind of gone back and forth on a couple things on that. But um, that is something to pay attention to, that you can ask for some updated grant expectations when there is a force majeure. You just need to work prudently um, on that issue. Um, this goes back to reasonable duration and commercial reasonability. You just have to, again, work within the confines of what the issue is, and then propose as narrowly tailored scope on the revision as possible. Choice of law, you know, federally funded grants, you know, are going to largely support the state of which they're in unless there's a legal conflict with the state law. So in Kansas, there's very few conflicts. We've gotten kind of fortunate on that. But other states, there seems to be more readily conflicts between federal and state law. But so this is a little bit less of an issue in our neck of the woods. Okay, I'm gonna talk a smidge about prohibitions on discrimination. Most of these things you probably know they exist in isolation, meaning you know you need to comply with them, but you might not know that they tie back to a federal award. And so we're going to walk through these. And on the checklist specifically, I reference a ton of these statutes and regs. And on the checklist, that I just want you to know where they are generally, so that if you need a quick reference or you're reading something, maybe that could help um, guide you a little bit. But here are some of the anti-discrimination provisions that I pay pretty close attention to. And so we're going to walk through them one by one. The bottom provision, I'll openly tell you, deals a little bit more with the marketplace and navigator programs. And so that's kind of its applicability as it relates to that bottom bullet. But we'll walk through it. The federally assisted construction projects, Part 60 is pretty blatant, that and forward that you're gonna comply with anti-discrimination laws, particularly through the Equal Opportunity Act, and the Department of Labor. And so this is kind of your leading baseline on general compliance. But it leads you into a lot of things. So you have the Civil Rights Act, of course. It specifically calls out federally assisted programs. Again, health centers fall within that bucket. So you're going to comply with prohibitions on discrimination on the basis of race, color, and national origin here. And that's embedded in that Act of 1964. Fair housing. If you engage in a housing project, or housing program, this applies. So you you know, something I always like to make sure that people know is that you know, that housing initiatives vary in scope. So you know, HUD initiatives versus a hospice house. But this all can apply because you're providing housing as it is very broadly defined in the federal law. So housing can be literally the facilitating housing. And so it's this is a really interesting provision that can sneak up on you if you do housing-based initiatives. Disability, as it relates to the Rehabilitation Act, there's really two disability provisions. The Rehabilitation Act was really geared more towards school projects. And so this is really I pare it down to like school projects and outreach activities. But again, you can't discriminate on the basis of disability if you have a federally assisted program, that is in schools. And so that's where this provision comes in. Um, it also can tie back here a little bit to FERPA, which we'll talk about here in a minute. Discrimination Act, um, yeah, at all times, this Discrimination Act and not discriminating on the basis of age, again, uses the word federal financial assistance, which goes back to federal award. So yeah, again, we're pretty broadly defined here. Um, Uh, this is more of a disability, the true disability on the ADA side. They use this law to more encapsulate a bigger definition of programs, activities, and services. Um, uh, Here they're looking at state agencies and state rules that do not disagree or do not agree with the Fed. And so they use the original Disability Act in 1970 to draw us in, and then they used this as reinforcement, primarily if you were engaged in Medicaid programs. So you're not going to discriminate on the basis of disability. Probably the biggest and sneakiest provision in the anti-discrimination provisions, and sneaky in the sense that you don't know it exists, but it does apply, is that there are very specific protections for whistleblowers. Um, so if the best way I could coin it is if you have a federal award, and that award facilitates personnel, meaning you pay for staff with it to do services within your entity. If that staff, um, or really any staff associated with that program, believe and they use terms like gross waste, mismanagement, abuse, are inappropriately that the entity is inappropriately using the funds, and they believe that they can report it to the applicable agency. They can report it to you. In real, there's no if that report's made in good faith, you can't retaliate. And so, sometimes I think this gets lost as it relates to, you're not supposed to retaliate on specific other cross sections of law, right? If people believe that there's discrimination, and you're supposed to have good faith reporting. Well, a lot of people don't realize that that does extend to grants. And so, I would just make sure you're aware that you should treat anybody that asks open questions about a grant and thinks that something may be wrong as a um, legitimate question, and that you can't retaliate against them. So there are whistleblower protections. Um, and so some of the people that these pure statutory law they can't talk to, they can talk to a member of Congress. So if you get congressional discretionary funding or an earmark, they can talk to the Inspector General. You can talk to the Treasury, the Department of Justice if you get DOJ grants, and then management official. And so it this is one that just kind of sneaks up on you, that you should be okay that people are asking questions about grants and maybe ask critical questions, but do it with a good heart. And so just keep that in mind. And then this is kind of the last one I was going to mention. So this patient protection provision as it relates to the Affordable Care Act. This really means that you can't discriminate, particularly if you're engaged in marketplace and navigator programs. So if you get federal assistance or state assistance to provide patient navigation of the insurance marketplace, if you do presumptive eligibility activities, um, you cannot you cannot discriminate on the basis of race, color, national origin, sex, age, or disability. This was a more all-encapsulating addition with the Affordable Care Act because they allowed private entities to do those activities. And they allowed not-for-profits that weren't commonly engaged in healthcare to do those activities. And so, um, just again, kind of one that not a lot of people realize, but this applies very specifically if you engage in marketplace activities or navigator activities. Um, okay, and then this kind of goes back to our core requirements. I would tell you that if you're engaging in a federally assisted program where you think you might be reaching out to people that you need translation services, you need to take those reasonable steps to make sure that you're appropriately engaging that activity. Um, some I've seen on some grants where, given we're required to basically have translation services and to provide care, that is reflective of the communities of which we serve. I've seen that. I've seen that this you can state that in a grant and say we're going to use our translation services as is, and this is going to be a form of in-kind contribution. And that really covers this and limits this concern. But there are several elements of federal law that talk about if you're seeking federal assistance and there's a chance that the recipient might not speak English or might need sign language, you need to make sure that's available. And whether you ask for it in the grant or you um, really take a step back and just say that I do this anyways because I'm a health center. Procurement, and I'm going to go a little bit quicker on this to allow some time for questions at the end. Um, this really, you have multiple levels. You have $2,000 and up. This is in what I'm going to talk about on this one specifically is about the wages of laborers and mechanics. What I would tell you is the Davis-Bacon Act pretty much specifically says that at all times, if you're engaged in procurement, and this aligns a lot with capital projects, you have to make sure that the laborers and mechanics and are paid a fair wage. And so you're going to state that somewhere in your grant. I guarantee it. The also similarly is an anti-kickback law that basically says um, you're not going to ask for inducements as a part of compensation. So just a very specific rules on making sure that people that work on your construction projects are paid a fair wage. Um, $100,000 and above. This really applies again, talking through fair wage and standards. Underneath this specific law, the Contract Work Hours and Safety Standards Act, they talk specifically about the 1.5 times the base rate in excess of 40 hours. So that they're saying, are even if you're not doing the laboring, are you making sure um, that exists? Um, so. The the sanitary nature and hazardous nature of some of these construction jobs, basically, given you, as we're going to talk about, you can't sue the federal government under certain elements. They want you to say, okay, well, you understand that I have to provide a sanitary, non-hazardous work environment for this as best as I can, knowing that it's a construction project and also knowing that I can't sue the federal government. And so that's always embedded in these grants is the fact that you're going to do the best of your ability to make it a safe environment, and even if it's not safe, it's still on you. So just probably a more common concern if you hire um, you know supervisor level general contractors to engage in that. this this is anti-lobbying actually, touches every part of our health center operation now, as it relates to federal grants, but it actually started with procurement. And so, uh, you're not going to use federally appropriated funds to pay for influencing or attempting to influence. Um, so this actually, I was inside a DOJ grant earlier this week, and this popped up as a newer drop down, and so this is a little bit more prevalent in all grants moving forward, and it's moved a little bit away from procurement. Again, just talking a little bit more um, about the disclosure lobbying. Then the 250 or above, the simplified acquisition threshold. I would tell you that this is where your bidding needs to come in pretty solid, and where you could use the checklist a little bit more to your advantage to ensure things that I wrote down that say bid packages on, those provisions are built in there, so that you can not have to worry about, if you're bidding out a job, that do you have a problem with a sanction or contractual violation. Um, then this is kind of my interesting kind of catch-all as it relates to contracts and grants. Um, Really, the UIE requirement is on all federally funded projects over $30,000. And you're going to submit the applicable information as relates to transparency, meaning if you're asked a question by the federal government, you receive a award of $30,000, you're going to respond to the question. Um, the seatbelt law has actually been in place, and that executive order has been in place since the Clinton administration. But if you're providing patient transportation, and you get federal grants or state grants for doing that, I sure hope you have embedded in a policy or procedure that you require your employees and to the best of your ability, your participants to wear seatbelts. That President Clinton was a big advocate of that. The reducing text messaging that started in President Obama's administration and has existed since. But again, you're not going to text and drive, and so if you receive federal grants to do driving and again patient transportation, you're not going to text and drive. And then this is uh, again, kind of a little bit different approach as it relates to auditing, but the government has very specific auditing standards, um, and they do have work paper examination rights. And so HHS has work paper examination rights if you receive an HAD grant, and that's so you just need to know it exists, regardless of if you have it in a policy or not. But if you receive an HAD grant, they do have that work paper examination right. We're not going to go through all these, but if you are a federally funded entity that does healthcare, most of these are going to apply to you. The HIPAA, high tech, and FERPA are three big ones. And so I expect that high tech is going to eventually, in the next couple of years, as we get to 2030, going to be a little bit even further updated, probably a little bit beyond what HIPAA is currently designed, and that's okay. But we will be required to continually protect patient health information while appropriately transmitting it and de-identifying it as required, uh, when a transmission is not a part of a audit or continuity of care. So, but these are our kind of big privacy considerations if you're receiving federal assistance. Okay, and then I have like three last slides. The compliance with grant requirements. This has been a little bit hotter topic lately. So if you're not found in compliance with applicable state or federal agency, really they have, this has been boiled down to five things. They can hold payment, disallow all or part of costs for an activity that they deem not in compliance, suspend or terminate the contract in whole or part, because the grant, once you signed it, is a contract. um, Withhold further awards. So if you have other pending awards to that particular department or agency, they can, kick your grant. So you kick your pending grant. So if you have multiple pending grants, because most grants now require you to disclose if you have a pending grant with that same office, or you have a grant that might have a service or activity that overlaps. And so that is a reason to punt you now. Is so if you're found in non-compliance with one grant, you shouldn't be able to apply for another or be awarded another. And then um, take other remedies as legally available, and that goes back to changing the scope of the grant, terminating it in part. So this is a big deal. This is getting a little bit more strict uh, as you're required to submit many things in federal grants and supporting information. You're always, I think we're always going to have more and more robust policies and procedures as we move forward, and you're going to be asked to do more consistent application of those policies and procedures. You can't have some federally designated policies versus state designated policies, but I expect that those will become less and less over time. But you're gonna, it's just going to be a little bit more robust. Um, Lastly, this is a sovereign immunity doctrine. This is based off case law. Um, Largely you can't sue the federal government if or state government if you believe there is an issue with how the grant is being done or administrated. There must be a statutory waiver of the immunity. There's a couple more prevalent state-based exceptions, but federally, really, it's just was there an action outside of congressionally delegated authority? Meaning, did that agency do something in that grant that they shouldn't have? Or was there an action outside of constitutionally delegated authority? It goes back to the responsibilities of those specific branches of government. Uh, and so those are pretty hard to prove. Those are high bars. But so the sovereign immunity statute, which has existed for decades, is likely not going to go away anytime soon. Clawback and recoupment. This goes back again to failing to do grant conditions. Um, they're going to typically hold payment. They're going to suspend the award. They're going to suggest debarment. They're going to do a lot of different things that are legally available to them. So, but if you're found in noncompliance, you go through your noncompliance period without appropriately correcting your error. Um, uh, there is clawback and recoupment laws, which have been used. So primarily, I think as it relates more to they start kind of with an audit finding that isn't resolved, and go from there. Okay, and then the last thing I'm going to talk about is just kind of what the other document you got today is the checklist and index. First off, that is not an all-inclusive list. I kind of wanted to hit high points as a baseline and foundational understanding, and as it relates to the slides and things that I've had to reference in the past or want to keep at my fingertips. And so you're going to see on that checklist, you're going to see 4 columns: condition, expectation, legal reference, importance, and where can you include it. And so if there's a question about debarment, and you're reading a grant, you're reading a contract, you're reading something, a lot of those general provisions are there as I included, and you can reference those. If it's saying that you need to include it in something you have, so you need to include that you understand debarment and you're not going to engage with anybody that's debarred, where could you make sure that you have that documented? Personnel, finance, procurement are three, policy sections, depending on how you define your policy sections. That would be good. And then you can make sure it's included in your policies and any subsequent contracts you were to engage in. So that'd be an example that I'd have for you. And so this is an easy list to kind of cross-reference and as things come up or Robert and his team find things, this could easily be updated by CC&K and then pushed back out and as new rules and guidance come into place. But I just wanted to give you guys or those that wanted it just a secondary source that you could more easily have at your fingertips um, uh, to use as you see fit. So, and then that's my contact information, and I think I went through a lot of stuff, and I left us, Christy, I left us very little under 10 minutes. I tried, and so but yeah, happy to take any
Yeah,
question.
you should be proud of yourself, Daniel. That was a lot to cover. So we do have time for some questions. I don't know if anyone has any questions they want to unmute and ask. Well, it sounds like Daniel either confused or answered every potential question. I did want to make sure everyone knows that we do now plan to have a second uh, webinar. We'll probably wait until after the annual conference, so probably in sometime in October. I know that another area of concern is some of the new stuff, especially that's come out in the last year and a half. In talking with Daniel, it's really important to kind of talk about some of the basics, but we do then want to kind of talk about some of the different things that you may see in grant awards and just also kind of where that's going. So we'll get that second webinar scheduled and let everyone know about it, of course. And definitely appreciate you doing this, Daniel, and your previous webinar and the one that you'll be doing upcoming on these issues. Just want to make sure there's no final questions, and if not, we'll end a few minutes early. All right. Well, I hope everybody has a great afternoon, and thanks for coming. And we'll get everything sent out, both the slides from today as well as the document. So y'all have a great day.